It's March 17th, 2020. Doug Ford just announced a provincial state of emergency in response to the COVID-19 outbreak. As he steps away from the podium, the first set of emergency measures are set in place. 2 weeks of lockdowns to flatten the curve. It's now January 2022. After a long 2 years of reflexive lockdowns, the measures are finally being relaxed and there is the promise of a return to normal. However, during this time, life did not just pause. For many, their lives were permanently altered. One group that was particularly hard hit were cancer patients. Our response to the COVID-19 pandemic had a devastating impact on the lives of thousands of women living with cancer. We are COVIDsense, a medical research group specializing in evidence-based medicine. We've partnered with a team of top cancer doctors and the Canadian Citizens Care Alliance to assess the impact that COVID-19 had on cancer. Our research has shown that the Canadian public health response was extremely disruptive to cancer care, producing dramatic and even deadly consequences. Looking at the Ontario Health Insurance Plan, or OHIP data, we see that billing rates for female cancers dropped dramatically in 2020, at about the same time that lockdowns began. In 2021, there was an equal and opposite rise in billing rates as lockdowns were relaxed, followed by a further rise in 2022. The same pattern was seen for breast, ovarian, and uterine cancer and reflects the rising rates of female cancers in Ontario. What could be causing this seesaw in new cases? Lockdowns were hard on health. People reported poor eating habits, lack of sleep, excessive alcohol consumption, reduced exercise, and excessive screen time. By the end of the pandemic, over 60% of Americans said they had developed a negative habit over the lockdown period. Bad health habits aren't just annoying, they can have a major impact on health. According to a Mayo Clinic review, poor health habits such as diet and physical activity can affect cancer survivorship. The methods used to compel people to comply with public health regulations were also harmful. They kept levels of stress and anxiety high. The hyper-focus on case counts, as well as the extreme measures taken to slow the spread of the virus, left many isolated and paralyzed with fear. According to the U.S. National Cancer Institute, stress-related psychological factors can have an adverse effect on cancer incidence and survival. Stress depresses the immune system, which is the best defense against cancer. Cancer is 6 times more deadly than COVID-19. When lockdowns started in March 2020, cancer screening ground to halt. Mammograms, the test used to detect breast cancer early, stopped. Rates dropped from 60,000 to 0. And cytological tests, the tests used to detect cervical cancer, went from 60,000 to 6,000. While cancer screening eventually recovered, it took until early 2022, almost 2 full years, to clear through the backlog. More than 650,000 women missed screening in 2020 alone. That's more than 32 times the number of people that Madison Square Gardens can hold at full capacity. Access to care was also deeply affected. A thorough physical exam is integral to an accurate cancer diagnosis. During lockdowns, it became next to impossible to obtain in-person care. In 2020, in-person primary care visits dropped from 750,000 in Ontario to 100,000. Care visits never quite reached pre-COVID levels, limiting access to cancer care. Compromised screening in combination with reduced access to in-person care resulted in significant delays in diagnosis for many women. This means that their cancers continue to grow and spread unchecked while they waited for their appointments. Early detection is key to cancer survival. The best outcomes occur when cancer is detected early. The chance of survival and recovery becomes increasingly slim with the passing of time. Stage migration is when a cancer moves from an early stage to a later stage. Over the course of the pandemic, fewer women were diagnosed early when their cancers were small and easy to treat, and more were diagnosed late when their cancers had spread and cure was off the table. In addition to a lack of early detection and stage migration, the public health directives also profoundly disrupted the delivery of cancer care. The delivery of appropriate treatment, especially surgery, is critical to cancer survival. Over the COVID-19 period, over 424,000 fewer surgeries were performed in Ontario. As of March 2024, 50% of patients with aggressive cancers were waiting longer than recommended. Cancer must be diagnosed early and patients must receive appropriate care. Anything short of this can be fatal. Deaths among cancer patients increased by 4.5% in 2020, with a dramatic spike in deaths in April following the first major lockdown. There were about 1,400 excess deaths among cancer patients in 2020 and an additional 417 in 2021. These excess deaths mirrored those seen in the general population and overshadowed COVID deaths, especially among young people. Most disruptions in cancer care occurred early in the pandemic when social distancing measures were introduced and non-emergent care suspended. A review of hospital care planning in Alberta found that only a fraction of the beds reserved for COVID were actually used, raising questions as to whether the disruptions in cancer care were even warranted. Policymakers overestimated the risk of COVID and underestimated the risk of lockdowns. We can do better. For future pandemics, we need to ensure that the risks of both the virus and the public health measures are factored into decision-making. We need to ensure that policy is developed by multidisciplinary panels to ensure the needs of all patients are considered. And finally, we need to figure out why female cancers are on the rise.